Welcome to our Daisy Award, our Spring Daisy Award. It's always a hard committee to be on because each and every one of you here is a daisy. But we go by the criteria of the Daisy Foundation, and we'll talk a little bit about that. I feel like I'm in nursing school, but the only thing that's missing is a bunch of nuns. I'm just saying. Okay. So we had a bunch of nominees, which is wonderful. The nominations came from patients, peers, family members, so it was wonderful. Before, at the end of my presentation, or our presentation, please stay, because there is another celebration for nurses as well, but today it's the Daisy Award. Talk a little bit about the history of the Daisy Award, and then we'll get into the celebration. In 1999, Patrick Barnes died at the age of 33 as a result of an autoimmune disease, idiopathic thrombocytopenia purpura. I'm glad it wasn't anywhere else but here today, because that would have been very hard to say. During those weeks in the hospital, Patrick's family experienced the best of nursing. They were there to witness his nurses' clinical skills and the nursing excellence that took them years to hone to the best of their profession. What they did not expect was the kindness and compassion they showed Patrick and all of his family every day. They were awed by the way the nurses touched him, spoke to him, even when he was totally sedated. The way they informed and educated the family eased their minds, and they were sensitive to the family's needs, kept them informed. They truly helped us get through the darkest hours of our lives with soft voices of hope and strong, loving hugs that to today they still feel. Patrick's family felt compelled to say thank you to the nurses for what they do every day for patients and families. So they came up with the acronym DAISY to honor us as nurses as well as their son. DAISY stands for Diseases Attacking the Immune System. The family created this program in 1999. As of today, there's over 5,000 healthcare facilities and schools of nursing in all 50 states and 31 other countries and territories committed to honoring you, the nurse. Finley has been supported and encouraged the DAISY. Today marks our 10th anniversary as daisies. So that's awesome. Thank you for the hospital. We are here to honor our nurses recognized by their peers and their families. Like I said, nurses can be nominated by patients, families, peers, and colleagues. The nominee is chosen by the following criteria. We are the nomination committee, and we base the criteria on the foundation of the DAISY Award. This individual is a skilled healthcare provider, a patient advocate, a mentor, a leader, educator, sensitive caregiver, and a team player. As well as we looked at how they supported our focus values here at the hospital. So, like I said, we've had a bunch of nominees, so the nominees can stand up when I say their name and tell you where you worked and how long you've been here. I put a different swing into this program today, as you can see. Captive audience, the doors are closed, you can't go. Okay, perfect, okay. So let's go ahead and read the nominees. And bear with me, I don't have pronunciation issues. Emmy Hinton, and you where you work?
I was in Paper Center for 2 years.
Thank you. Ashley DeYoung. Ashley DeYoung.
Format Surg, 4 years.
Heather Himes.
Rehab, 4 years.
Christine Kemp. I don't see, is Amy Schultz here? Amy Schultz? Okay, Amy Schultz, she's 5 med surg. Jonathan Stryer, he's, I believe, ED. He's not here as well. Piper McRae Egan. Okay. Okay, awesome. Join the ranks of the old people. Okay. Steve Day, he said he wasn't going to be here. He's ED. Ann Moser, way back yonder.
10 months.
Awesome. Great. Kelsey Ehrlich.
Cardiology in 6 years.
Heidi Schmidt.
Family Birthing Suite, 17 years.
Michelle Medford.
Michelle, ICU 1 year.
Good, welcome. Jessica Hannon.
ICU 16 years.
Great. Sarah Ryan.
Rehab 16 years.
Awesome. So you see our garden of daisies have wealth of knowledge, experience. But we took the top 25% of the votes. So the following people, please come to the front. Christine Kemp. Ashley DeYoung. Okay, put my glasses in, my mouth doesn't work. Okay, Jessica Hanton. Sarah Ryan. And Jayde Russell. Okay. For some people, this is very stressful, so we'll make it real fast. Okay, so what we're going to do is now we're going to read the stories of these individuals and then let you know who our Daisy winner is. Okay. So, do you want to read this one? Oh, that's, yep, that's not, oh, you're good. Okay. You're good. Okay, so. Huh?
Sarah doesn't get any?
I get to read that one. Oh, I know. Yeah, go ahead. We'll start reading them, and then we're going to tell you the story that got them to the front seat. It wasn't God, it was us.
Let me start?
Please.
I need your microphone.
It's glued to my hand.
This is about Christine Kemp, and she has 2 nominations here. It says, to pick a specific event that shows how Christine goes above and beyond for her patients is very hard to do. Christine has worked tirelessly since the start of her nursing career to ensure our patients are always receiving the best care possible while in the ICU. Christine has been a constant nurse in the ICU for many years. Through all the hard times the unit has faced with staffing and large patient care volumes, through the pandemic, she has exemplified what it means to be an extraordinary nurse. Each and every patient Christine cares for is treated with the utmost respect, kindness, and compassion. Christine is always willing to go above and beyond the call of duty to help patients, colleagues, and other staff members in our organization. I have heard on countless occasions from Christine that she loves her job, and Christine loves to say she works for Finley. We have all faced great struggles the last couple of years, and just when you think this rock star of a nurse couldn't take much more, she leaves each shift happy and ready to put her mom hat on to tackle the joys of motherhood. Overall, Christine lives our focus values by always fostering the team to work together to be the best versions of themselves. Christine owns every moment, task, or obstacle put in front of her. She champions excellence through the care and compassion and provides for our patients, but most importantly, seizes every opportunity to help our organization be the best it can be. That's the first one. And now a second one. This one's a little shorter. A patient and their parent presented to the ICU from a shelter. The patient only had a minimal amount of clothes. Learning that the patient and parent were having a rough time, Christine went out and spent her own money and time to get the patient clothes and toys to take back to the shelter. Christine always takes great care of the patients and goes above and beyond. Christine was completely selfless in this and so many other situations. No matter what the situation is, Christine always puts her patients first. Christine is always calm, kind, and loving toward her patients and their families.
I'm always forgetting things. I forgot some other nominees before I continue on. Betsy Borland is from Med Surg. She here? Betsy, how long have you been here? How long have you been here?
I think 9 years.
Okay, good. Darlene Jackson. I thought I saw Darlene. How long have you been here?
43 years.
How many?
43.
Oh my goodness. Chris Asbury. How many years you been here, Chris?
Oh, over 40.
Amy Schultz is here now. Amy, how long have you been here? Okay, thanks. I'm sorry, my deck of cards got out of line here. Okay, let's go ahead and continue on.
The hairspray again. Okay. I've worked alongside Ashley for 1.5 years now, and to this day, I'm still astounded by the extraordinary patient care she gives. Ashley takes a genuine interest in her patients, and you can see them light up when she walks into the room. It's hard to pinpoint one specific story to tell because Ashley is adored by so many. I cannot count how many times I've walked into a room the following night after Ashley cared for a patient and they asked about her. Ashley is always attentive and compassionate, making sure the patients are fully satisfied before moving on to the next task. Not only is Ashley's care exemplary, but she is an excellent team player as well. A coworker one can always count on in a pinch. When I think of someone who deserves recognition, I think of Ashley DeYoung.
Okay, this nomination is for Jessica Hanton. I was admitted to the hospital in November of 2021 for COVID. I was admitted upstairs but taken to ICU shortly after that. I was a patient in ICU for almost 2 weeks straight. I saw a lot of nurses in the ICU, but one stood out to me, and that was Jessica. Jessica had a calming demeanor whenever she was in my room. She took time with me as a patient and never made me feel like I was a bother. Jessica helped clean me up, changing my bedding, and even helped me with my hair. I had so many wires and IVs and did not feel well as I was diagnosed with COVID. Jessica spent many hours in my room. She was compassionate and caring. Jessica always made me feel at ease, even though I knew I was very sick. She never seemed too busy to answer any of my questions. Jessica is a true asset to the nursing profession and especially Finley Hospital. Jessica treats patients like they're her own family. I am thankful Jessica was there to help take care of me, and for that reason, I nominate Jessica for the Daisy Award.
Okay, I'm going to tell you about Jade Russell. Jade has completely changed my entire opinion of the hospital experience. She went above and beyond the duties of the job description and has proven and displayed all criteria for the Daisy Award. I was admitted to the hospital via the emergency room. I loathed hospitals and had no intention of staying, especially after the horrendous experience at another hospital the day prior. My emotions included fear, anxiety, confusion, and depression, all for various reasons. My hospital stay lasted a total of 8 days. During my stay, Jade was my nurse for 3 nights. The first night, Jade entered my room to introduce herself and get to know me as a person and not just another filled bed. She reviewed my medical plan with me and kept me informed during the next steps throughout the night. At each shift change, she made a point to come into my room, greet me, and update my whiteboard with current information. She would then take a very thorough check of my vitals and let me know what they were, which really helped my anxiety. Also reviewed all my medication with me and asked if I needed anything. I forgot creating a schedule for me to take my medications and completed the nightly vital check. She did this in a way that did not interrupt what little sleep I got each night. Jade ensured to answer the call button in a timely manner, would bring me 2 drinks I needed without asking what I wanted, made a point to pull all the full trash bags, empty the urine collector in the toilet, and removed all food trays. When I had questions for the doctor, she provided a clipboard, paper, and pen so I could write them down and not forget them. When I started to get regular nosebleeds, she took the time to explain the best way to stop them, gave me extra boxes of tissue, and spoke with the doctor to get nasal spray prescribed. Each time Jade gave me any medication, she made sure to ask if I used the nasal sprays to document those as well. Jade made me feel comfortable enough to take a real shower. When I got water on my IV and she couldn't get a new one in after a couple of attempts, she requested assistance from a colleague. Jade took this situation as a learning experience. I was inspired by her willingness to further her education to make herself an even better nurse. I was also impressed that she was able to acknowledge when help was needed. She went out of her way to make me feel special, even writing happy birthday on my whiteboard, bought a little Debbie cake, and a card signed by her and other nurses. She also gave me one of her personal bottles of coffee after I mentioned I missed good coffee. She wrote a special note on the card after discharge as well, even remembering my dog's name. Of course you do, right, Jade? Jade is a marvelous asset to the Finley community. I will never be able to fully articulate how much I appreciate Jade and how much she did to help both my physical and mental health. I am very thankful for the time she was my nurse. Jade's a bright outlook and optimism were 2 things that really were spectacular. In a time when healthcare workers are underappreciated and overworked, she is not allowing that or any stress to affect how she cares for her patients. Jade did not have to do half the things that were done for me. To some, it may sound like she was doing her job. However, to me, it was life-changing. I hope I have provided enough examples of how Jade has displayed the Unity Point focus values as well as providing extraordinary and compassionate care. I kindly request you seriously consider Jade for Daisy Award. I appreciate you taking the time to read the entirety of this nomination.
Great. We'll just be a little more suspenseful here. Twice a year we have Daisy. We have a spring and a winter one. In the spring we have a Daisy nurse as well as a Daisy leader. I'd like to read Sarah Ryan as a nomination for her Daisy leader. The broad definition of a nurse is a person trained to care for the sick or infirm. It implies that the person carrying the title is simply providing resources on how to deliver care for those unable to care for themselves. It leaves volumes of words unspoken. It leaves endless emotions silent. It takes an incredible caring, patient, and passionate person to become a nurse. It takes an extra dose of dedication and focus to become a nurse leader. It takes someone who allows their own personal and professional needs to go unmet simply to satisfy the needs of others. It takes someone who shows up daily and puts the time in to get the needed work done. It takes one-of-a-kind person willing to go all in for their team and their patients. That is the type of nurse I want to care for me or my loved one. That is the type of nurse I want to work alongside and learn from. That is the type of nurse I'd be honored to call my coworker or leader, and that nurse is Sarah. Sarah shows up daily with a smiling face and a grateful heart. Sarah shows up daily even when it's not easy to show up. Like many of us, Sarah has faced significant personal and professional events over the past year, but Sarah's still here, always showing up. Sarah demonstrates the ability to ensure everyone on the team feels valued and cared for. There is no 8 or 12-hour day for Sarah. There is really an actual day off. She is available 24/7 to ensure the nurses and techs on the team feel supported to provide the best care to our patients. Our unit has recently cared for complex patients with extreme family dynamics. Sarah enters this room each and every day with a smile and a listening ear. Sarah continues to demonstrate the focused values by fostering unity with her team to stay positive, owning the moment with difficult decisions needing to occur, and championing the excellence of going above and beyond to meet an often impossible demands. Sarah continues to show up for the patients and advocates on their behalf for the best possible outcome. Our unit and our organization as a whole is a little bit better simply because Sarah is part of it. So Sarah is our... I'm going to drag this out a little longer. As you leave today, take a cinnamon roll. It's one of Patrick's favorite treats when he was in the hospital. And he always bought one for himself when he was able to eat, and always one for his nurses. Also part of the Daisy is they get the Healer Touch statue here. It's been created by a tribe in Zimbabwe. Thank you. There's a reason why. There's a reason why you're here. Okay. Each sculpture is hand carved, so everyone's going to be different. It's especially meaningful in embracing the relationship of a nurse and a patient. Profound respect to the traditional healers. The healers are treasured for, and that's basically what they're saying is they show what the Daisy Foundation believes in. So, our Daisy nurse for spring 2022 is Jade Russell.